Hi, everyone. I just started the recording so we can get started with the pre-health, pre-med or orientation. My name is Ron Reyes. I'm one of the senior associate directors here at the Career Center and one of the pre-health, pre-med advisors. We'll get started today with just a quick agenda of what is in store. So some introductions, a little bit of a health beat overview, some professional and academic considerations for healthcare professions, talking about building experience, additional considerations for students, and then resources and Q&A. So we have a lot on the agenda, and I'll get us started with just some quick introductions for me and Jade. So myself again, Ron Reyes, Senior Associate Director. I am one of the advisors that helps with pre-health advising along with Jade here at HealthBeat. A little bit of background. I have been in higher education now over 16 years, give or take. I have a master's in human behavior, an undergraduate primarily within the arts. Originally, I planned to be a teacher and ended up working in higher education. Haven't looked back since. Most recently, before UCSD, I worked with a health education school, primarily with nursing, and then moved on to UCSD, post-baccalaureate programs in healthcare education, followed by being here at the Career Center. So happy to be here and join you all, and I'll hand it over to Jade.
Hi, everyone. So my name is Jade Frame, and I am one of the associate directors, as Ron mentioned. Just a little bit about me. I got my bachelor's in neuroscience, my bachelor's of science in neuroscience. I was actually a pre-pharmacy major and decided to switch after a couple years to counseling. So I have my master's in counseling with a specialization in college counseling and student services. And yeah, I've been here at UCSD for about 3 years, and I speak for us both that we're very excited to work with you all. All right, so let's go ahead and talk about the Career Center, who we are. So there are quite a few of us here, and so there are three main groups of advisement: arts and humanities, STEM, and pre-graduate, graduate. And so as you can see here at the bottom, Ron and myself are pre-health, pre-med specifically, and we will help answer any questions that are in that realm. Now, if you have any general questions, such as resume, cover letter, even career exploration, or you need to meet with someone more urgently, then Ron and I may be available. You can reach out to any of the folks here and meet with them one-on-one. So we did want to let you know about that. Okay, so let's go over HealthBeat and what that even is. So what we do is we help students explore, prepare, and apply for their chosen field. And so we have a ton of resources available. You see also by the way, our Instagram right there at the bottom left, and our website. Our website is going to contain all of the information that you need, all of the general information that you need for different healthcare careers. And so where do you start? You want to go to this website, as I said, and you can scan this QR code. And as you can see, we have about 9 different tiles: medicine, dentistry, pharmacy, PA, optometry, PTOT, veterinary medicine, public health, and nursing. And so if you go to our website, you can click on one of those tiles, get more information about your chosen career field, and they'll be organized in the explore, prepare, and apply sections. And so click on whichever section. Definitely start with explore, but if you want to get straight to the nitty gritty of resources, you can definitely go to prepare and apply that tab. So that's a little bit more information. And just going into what is HealthBeat, right? So HealthBeat is our centralized pre-health advising and resource center on campus. It's basically Ron and myself, okay? So there's 2 of us assigned to about 10,000 students, give or take. And so we helped you guys explore and understand the differences between health professions. We advise and counsel you, as well as give you information on professional trends and any kind of nuggets for admission. And just make sure that you're ready to go there. we really help you guys navigate the application process when that time comes, and in the interim, professional planning as well. And so just to let you know, we do have our YouTube, which I think is linked at the end on the UCSD Career Center. If you just Google that, we have a Health Beat playlist. As I mentioned, there are about 10,000 students, give or take. And so we post our webinars and our presentations on there, our very popular ones. We'll post that on our YouTube so you can go back and watch and get that information. And we tell students, use our website before you make your one-on-one appointments with us as well, because we want you to have the baseline level of information ready to go. So our one-on-one time with you is more tailored to what you need and is a little bit more specific, and things that you may not be able to find online on our website. Okay, so as I said, our one-on-one handshake appointments are made through Handshake. Click on Career Center Appointments, and then you'll be able to find an appointment. Just note that we release these 2 to 3 weeks out on average, and sometimes they'll get booked up after about a week. So if you don't see anything, check back maybe at the end of the week every Friday, and you can also check back intermittently dispersed to see if there are any cancellations, because we do get cancellations sometime as well. Ultimately, though, we try and scale and post on our Career Center YouTube in case you don't have access to us right away. And so we'll try and post things on our YouTube, and we have a few videos there. We have workshops and conferences as well yearly. Our MEDS conference is in the winter quarter, and that's just a great way to network, hear about so we have booths set up for pre-health or medical schools, graduate programs, and other resources. So it's just a great way to get more information and network, as well as our underrepresented in medicine conference, which is in the spring quarter. So these two we do that every year. Anything that we post will be on our Facebook, /Instagram. So as I said, please follow us. That is how you're going to stay up to date. And the links are generally to our Handshake. So we kind of broadcast on Facebook, and then you'll get a link to the Handshake to sign up for these events. The other thing we do is we have our Medical School Prep 101 course. It is called SMPH 95, so it's under the School of Public Health, and you can register for that. It is typically for first year and sometimes second year students and first year transfer students. And it's a 1-unit course in the winter and the spring. We would love to have you. We open it up sometimes to 40 students. And so it's just a great way to meet with Ron and I and just have FaceTime with us weekly. And it is usually in person as well on Wednesday. So more information on that will be coming up closer to winter quarter. And then last but not least, we have our quarterly drop-in week, which is new this upcoming year. And we will schedule that for during the drop deadline. Generally, I think week 4 or 5. And so you can find that information on Handshake. You can just go to events and type in drop-in week.
All right, so now we're going to hop on to professions and academic considerations. So, the healthcare has quite a different spread of different opportunities for students, above and beyond just medicine. So, what we like to do a lot of times is kind of break down for you some of the differences in pathway when you are looking at healthcare professions. So, like, for example, one that a lot of people don't notice is on the far right, which is public health administration. That's still healthcare. It is just a different part of healthcare, right? So that's possibly working with the government, that's working within facilities and running and operating healthcare systems. So that's one kind of pathway that we don't see all the time that we like to sometimes mention. If we're talking about the other professions listed here, medicine, PA, nursing, dentistry, pharmacy, physical therapy, this kind of gives you a spread in understanding that each of these professions, although healthcare related, have different timelines and levels of expectation for application. So we're going to just touch on a little bit about that in this slide, but I want to break this down because we usually have more than just MD students applying into healthcare professions in general, right? So I'll start with the most commonly known or most familiar. So I have medicine, MD and DO. Usually that is a 4-year track in graduate school. So that is 2 years of didactic or lecture plus 2 years of clinical rotation where you're doing applied surgeries and working through both simulation labs and actual hospital sites. From there, we then move on to residency. And residency, like any practicum, is really about applied on-the-job work experience for healthcare. So with MDs, for example, the shortest time frame is 3 years of residency. But if we have subspecialties, specialties, subspecialties plus fellowships, it could be much longer than that. So I always remind everybody that if we are committing to something like MD or medicine in general, it is a much longer track than some of the other healthcare professions that we're going to be talking about. Another one that I like to highlight is nursing, because nursing can be very different than some of the other ones in that really it's about 2 to 3 years of dedicated training, whether it's an accelerated BSN, a transferred in BSN, or a master's program. But um, with nursing, you don't have any required post-educational experience, right? So for example, with the previous example of MD, there was that residency requirement where a profession like nursing, there might be some opportunities to do preceptorship in a specialized area, but most of the time you can just hit the ground running as a nurse right after you pass your NCLEX exam and are a practicing nurse right out of your education. So again, when we're thinking about the different speed and pathing with healthcare, I like to kind of point out some of these differences in training timelines because it can make a difference on where you might be leaning towards with the type of work you're doing. Right? Some people who like some of the work of a MD might consider a PA or physician's assistant because in only about 2.5 to 3 years time, you can do a lot of the different areas that are associated similarly to doctors, just not at the same level of responsibility. So that might be a good mid ground for some professionals. However, the other thing that I do mention is that some of these professions like nursing and PA do expect before you even apply into their program that you have prior healthcare or clinical experience under your belt. And for PA, it's even many times that we'll see a couple thousand hours minimum or expected of a lot of those applicants. So I just want to kind of give a quick breakdown of different professions. And then I saw on the Q&A that where does psychiatry or a psychiatrist fall? Well, a psychiatrist is part of the MD or DO or the physician chain of work. So in order to be a psychiatrist, I first have to go through all of my medical school training. So those 4 years, then I'm doing additional residency. And then from being in standard residency, I'm going to probably fellow or specialize into the subspecialty of psychiatric work, and then do another couple of years of psychiatric work. So it can be a bit longer to do something like a specialization such as psychiatry, but it is, again, part of the grand scheme of things. Before you specialize in any sort of medical profession, most admissions people are going to say it's great if you have that interest, but get into medical school first. And then once you get through your clinical rotations, you start figuring out where you want to apply, and you could end up in a specialty like psychiatry. All right. So uh, we get this question a lot. What major do I choose? I'm going to say this right now. Just choose a major that interests you. Okay, so you don't have to necessarily have a STEM major or a science major to do well in a healthcare profession. I will say, though, having either a minor, a major, or even a double major that allows you to get access to a science coursework if you don't normally get access to science coursework can be beneficial for students who are trying to make sure they can fit in all the prerequisites that they need. But by and large, you can have a lot of students who are not a STEM major make it into the healthcare profession pretty easily. I know quite a few students coming in from, say, for example, psychology or even some schools like anthropology, because they have an interest in how people work, and then they put on top of that additional science coursework and testing in order to show that they are a good fit. So speaking of coursework, the next thing that we get a lot of questions on is AP or IB credit. So I'll say this, even if you're a transfer student, you may still have AP or IB credit, and you might have got that credit accounted for while you were at the community college. If you did, then you're going to need to also make sure that you got those credits evaluated by the registrar when you transferred into here. But I like to mention that, in some way, shape, or form, if you do get AP or IB credit, we still use them here at UCSD, so I do have to mention that. One of the questions I typically get around AP credit or credits that they transferred in originally from the community college that were from places like AP credit or IB credit is, does it count for medical school? The answer is it depends, right? Community college, classes I've taken there, it's college level credit, it's fine. AP credit, it depends on the school we're talking about. How do they take in tested coursework? Usually we'll say a lot of times they may be fine as long as you've done advanced or additional coursework within those same subjects that you got AP credit for. If you're not sure, or if you want to double check, I highly encourage, first make sure to review everything that came in on transfer, and then set up a time to talk with us if you are one of those students that have additional units from something like AP or International Baccalaureate credit. Speaking of credits, so as far as sample courses, I break it down to two parts. So the first part is on the left side, what you see are traditional medical requirements for any student applying into medicine. And then on the right side, you see what would be considered highly recommended but not required for medicine, and for some professions actually potentially required. Okay, so I'll give you some examples. So on the left side, you might already have transferred some of these courses in from your previous institution. If you haven't, or if you're missing some, we've put a sample of what are some traditional med school requirements and the types of courses you could take at UCSD to get them done. If you've already completed a full year of something at the community college with good grades, you might be fine not having to take them here. I just like to put them there for demonstration purposes. Same goes for some of the courses on the right. So just to give you an idea, both nursing and PA typically like to see courses such as physiology, microbio, and anatomy. All of those usually with a lecture and a lab. Okay, that's not necessarily a called out requirement for professions like medicine, who have you do a lot of other prerequisites. But I like to call these ones out in particular because they are very popular for professions such as nursing, PA, dentistry, and they'll specifically want to see what level of coursework have you done with it. And depending on the school, some schools might have a different level of additional courses outside of some of those. But I like to put that hit there for you all, just so that you can start seeing some of the additional types of courses outside of what would be required for medical students. And then I just noticed a question on chat for required work hours for dentistry. It's really more shadowing hours, and we can get to that later in the Q&A. So course load. Now, as a transfer student, you may be coming in with a lot of units, and that might mean that you might be starting off with upper divisions. So I'd like to just remind everybody, depending on your course load, be mindful of that advanced coursework can be a bit more demanding. So be mindful of the units that you're taking. 12 is still full-time. 12 quarter units is still full-time. So if you find yourself needing to have a slightly lighter load the first quarter that you're here, I understand that. I hear you. It's okay that if you do 12 quarter units, just be mindful of that before going on and taking on more course load. We want to make sure that you get some good pacing in before you get into the thick of everything. All right. Lighter loads are still acceptable. You also need to graduate, so we're going to have to play a careful balancing act between units as well as the timeline that you are hoping to complete everything. So as far as sample timelines, I like to give you a couple like just a couple recommendations and tips to think about when looking at sample timelines. So we publish more in-depth versions of these things on the HealthBeat website. So if you go to the prepare section of the area that you're interested in, whether it's like MD dentistry, DPT, you name it, right? We have different sections with sample timelines, and then on the 4-year plans, there are also samples for transfer students. So I do like to put that out there. Um, but in general, we want to think about, okay, what do I have left? What courses am I still going to be taking? And then what are some experiences I still might want to take? So for the sample timeline that we have here, so say first year at UCSD, you're incoming junior, maybe you haven't taken organic chemistry yet, so maybe you're going to take the organic chemistry series when you're here. Maybe you haven't transferred in physics, so you might be taking that here. And we'll say like during your first year here, it's really okay. What do I have left, and can I do that in an efficient way the first year that I'm here, whether it's additional biochem, or what have you, right? During that same time, you only have a couple years here, so we want to immediately hit the ground running with maybe networking and joining and making use of the limited time you have here. So that can be getting to know professors, joining different student orgs on campus. There are some student orgs dedicated to transfer students as well, so keep an eye out on that. Some students like to get involved with those orgs, or maybe find part-time work where they can provide a little bit of a student org leader support by the time they finish their time here. And besides that, a lot of students think about, okay, what are some of the things I might have not have access to originally when I was at the community college that have access to here? So maybe at the community college, you had a harder time signing up for something like UCSD's student run free health clinic provided by School of Medicine, or maybe you really want to just take a crack at research, but you only want to do a little bit of it. Now that you are at UCSD, who is a research one institution, there's a lot of different opportunities to see if you like it or not, right? So think about the experiences that you want to try out early with the time that you have here. And then say for the second year, we could have somebody finish out what other additional courses that they might be considering. This sample is with the idea that maybe I'm going to be applying to medical school at the end of my senior year. So during my last year here, I'm making sure that after I've known professors, maybe I'm looking at which of these professors might be good letter writers and having those conversations early. I would find out maybe 6 months early, are they somebody that even does letters to begin with, right? Like find out early, and then continue to build experience leading into application. Okay, so again, this is just a sample, but it gives you an idea of uh, some basic planning that we usually go over a lot of times with students, to kind of map out, okay, given how much time I have at UCSD, what is the most efficient use of my time and opportunities here, so that I could leverage that for purposes of application. All right, Jay, should we take some of the questions here, or save it till the end?
Let's take some questions since we have, a little bit more flexibility. The next one, it looks like, did you want to start with, are there any required work hours for dentistry?
They usually have published on the dentistry websites a lot of shadowing expectation. So a lot of them will say that they either require shadowing or don't, and usually it's a few hundred hours. Not all dental programs will expect you to work as a dental assistant, but a lot of students like to do that anyways because it's a great opportunity to get paid and still get exposure. The other thing is, if you're working as a dental assistant, you get a lot more face time talking with dentists, which is always ideal, since you do typically need a couple of letter recommendations from dentists.
And then the next question, if you're still applying as a PA, do you need to have OChem and physics?
Not necessarily. The great answer with PA is it depends. So if it's not anatomy and physiology, which are like the hallmarks of expectation for PA, all of those are more dependent on the school that we're talking about. Like for example, UCSD's PA program typically expects one coursework in organic chemistry, but not the full series. Other schools might just expect chemistry and not organic chem. Some might even be more expected to ask you to do a little bit more. Okay, so it's not a set combination that will capture every single PA program, but usually the list of expected called out courses is not as high. But it always is going to be dependent on how many PA schools you want to apply to, and of those schools, are you missing anything? We also provide some examples on the PA section of the HealthSpeak website if you want to look at a sample of different schools in California and the different level of expectation for course content there.
Cool. And I'm thinking because we're getting a lot of questions, we may have to parking lot them till Q&A, and some of these will be answered during our during the rest of the presentation.
All right. Did you want to take on?
Yes.
Yeah.
Let's do that. Okay, great. So let's talk about pacing and self-care, specifically for my transfer students. You spent 2 or however many years at your transfer institution, at your community college, and now you're here and you generally have about 2 years before you graduate. And so it's really important to kind of balance self-care as well as get the things done that you need to get done. I say organization is really important for students, especially pre-health, pre-med students, and basically kind of projecting out what your 4 years will look like, or your 2 years rather will look like here. And so I was explaining to one of the last presentations, one of the last groups, that Maslow's hierarchy, right? Basically, what this theory talks about is you really want to have the baseline, your basic needs met. Okay, so that's things like learning how to do your laundry on campus, making sure you know where to get food. Transition is often very hard for students, so using counseling and psychological services, or CAPS, right? So make sure you get the support you need so you have your basic needs met. And then after that, you can kind of reach the pinnacle of that pyramid, which is self-actualization, or achieving your goals, okay? And so we just want to kind of frame that for you. Grades do matter, but pace yourself, okay? If you need to stay an extra quarter or an extra year, generally financial aid will cover you for 5 years. So just talk to your financial aid office, talk to the financial aid office about that. Talk to us about your timeline, and we can help you as well. Support such as tutoring, advising, and office hours are really important as well, to make sure you have the support you need for your classes. And office hours are also really important, for office hours to get letters of recommendation, hopefully to get to know your professors, right? Also, we talked about some resources. I mentioned CAPS. The Triton Transfer Hub will be super helpful. They have events every so often for transfer students, and they have different resources available that are specific for transfer students. We have OASIS, different advisors through the college, your major, and some students are a little bit confused about that. You should have gone through orientation to have access to your advisors, but your major advisor will help you with courses that you need for your major, and college advisors will help you with, what do you kind of overall need to graduate, a little bit more general than your major advisor. You can meet with either of them depending on the questions you have. There are cultural and resource centers on campus. I'm personally connected with the Black Resource Center. I think Rob's connected with the Transfer Center, LGBT Center, right? So you can ask us if you have any questions, or reach out directly to the resource centers, as well as us, the Career Center. Definitely enjoy this time, because it does go by really fast, right? It's doing a lot at once, but I think looking back, it is a great opportunity. It's a great experience, especially, I look back on my years as an undergrad, and it was a great experience, even though, yes, it was stressful. I was a neuroscience major. There was a lot going on, but I wouldn't change it. And just continue doing what you love. So sometimes students will need to do a post-bac program. You may have heard this term, post-baccalaureate program. It sometimes is necessary. It's specifically for students after they get their undergraduate degree. generally doing during the gap years, which we talked about, right? So the year after you graduate and before you apply to your graduate school program. It typically helps you improve your GPA, although there are some post-bac programs that are career changers. So maybe you were a political science major and maybe that's something that you were interested in and you never really got enough experience or even the coursework that you needed for medicine. That is also a program that you can do, a career changer program as a post-bac. Now, if your GPA, you saw the slide with the GPAs, right? The kind of the averages. If your GPA falls below those averages, it might, and again, you would want to meet with Ron or myself one-on-one, but it might be necessary for you to do a post-bac. We just want to let you know that you have options if it comes to that. It does help strengthen your application for grad school, and it's a great opportunity to show focus and rigor before you transition. You actually, specifically for medicine, will be taking medical school level courses. So if you do well in your post-bac program, it is really, really helpful, sometimes 80, 90% plus, every institution is different, chance of getting into the graduate school of your, a graduate school, maybe not the graduate school of your choice, but a graduate school for sure to meet your goals. So here are, as you'll kind of hear differences between post-bac and special master's program. You've probably heard these terms thrown around. And so basically for post-bac programs, there are academic enhancers, which help improve your core science GPA, which is generally 2.8 to 3.4, but sometimes it just depends. 3.4 may be too high. So we would have to speak with you one-on-one once you get there. There's career changers, as I talked about. This is a great way to also, for those who are economically or academically disadvantaged, it's really helpful to get more experience in, clinical experience or more tailored support in your pre-health classes. It's also great for underrepresented or marginalized students who may have not had enough support in high school or their community college, or even they didn't feel like they had enough support in their undergrad. So the reason that we're bringing this up is because we want students to know that there are options if something in life happens, or if your grades fall, or anything like that. But just to speak on the special master's program, this is generally to get more research and connect also with faculty. So you'll see people do either a post-bac or a special master's program depending on what their goals are. Okay, if your goal is to boost your undergrad GPA, that's a post-bac program. The special master's program is not undergrad GPA boosting, it is only graduate school GPA. So students who have a lower GPA may need to do the post-bac program. And then you have, for special master's, students who may have a good GPA, maybe an average GPA, but they just want to get a little bit more experience. They want to get a stronger letter of recommendation. They want to focus on research, okay? So definitely talk to Ron or myself if this is something that you're considering, but we wanted to give you this information. Okay, so I'll also talk about building experience. And so many of you may already know that in order to get into your graduate school program, your medical school program, right, you will need some sort of experience outside of coursework, okay? So specifically for medicine, the AAMC 17 core competencies go over what medical schools are looking for in a student, more like soft skills or transferable skills is what we call them. And so service and clinical experience are ways to meet those core competencies, such as service orientation, ethical responsibility, multicultural competence, right? So all these things are needed in a well-rounded professional who wants to go to graduate school. So service specifically is a direct, meaningful interaction which aims to fulfill a need for a vulnerable community with a long-term impact. So some examples are working with refugees, working with the homeless, maybe low-income families, or historically marginalized communities. Some organizations at UCSD are the Mustard Seed Project, Education Corps, and Homeless to Heal. Or Homeless Heal. And so you'll notice that service is not necessarily clinical or medical related, right? It still helps you meet those core competencies to be a well-rounded professional. Clinical experience, on the other hand, is direct interaction with patients with the aim of providing medical service or education, generally in a clinic or hospital setting, and contributing to patients' healthcare outcomes. Okay, so some examples are emergency medical technician, certified nurse assistant, phlebotomy, medical scribing, medical assisting. Some of you know about shadowing. Shadowing is not considered clinical experience specifically for medicine. When you enter shadowing onto the application, it is listed into a separate category, okay? So make sure that you get separate experience outside of shadowing. But shadowing is helpful to hopefully learn a little bit more about the culture of an organization, maybe even get a letter of recommendation from that person that you're shadowing, building that relationship, okay? So it's still necessary. Some organizations at UCSD are Emergency Medical Services, Flying Samaritans, International Health Collective, and the Global Health Brigade. Now, I do want to mention that there are 5 different areas that we want students to have for experience, okay? Many of you know about clinical/service, which we've gone over, right? There's also research. We talked about shadowing, and then the last one is leadership, okay? So there's 5 different areas: healthcare, service, shadow, research, leadership. Okay, so those are the 5 areas, and we wanted to kind of differentiate some of these for you. So moving on to research, which I just mentioned, this one is kind of like an asterisk. It's if interested. Okay, so research if you're interested. Academic and clinical experience are your top priority. So we want to make sure you get that, get that straight. Research is not a requirement for most programs. So if it's something where you're applying to an MD PhD, yes, it's generally required. Or maybe you are applying to an institution whose values or mission, right, are contributing to the field of research. And that's something that maybe historically this institution has prioritized. So in those cases, yeah, get research experience. Otherwise, I would say, think about what's most important to you outside of research based on those 5 areas that we talked about. Some benefits of research are you do get exposure to other parts of science. It is a great networking opportunity. You can potentially get a letter of recommendation from your PI or principal investigator, which is super helpful, right? That's 1 out of 4 to 6 letters. You will need 4 to 6 letters of recommendation, by the way. And so we're trying to help you be strategic and which experiences you may want to look at for meeting the competencies, right? As well as hopefully getting those letters of recommendation. So we tell students, specifically, my transfer students, you have, like I said, 2 years, and there is a lot to be done. So just make sure, you're focusing on your academics, right? Once if your GPA drops, it is hard to get that back up. So we want you to spend your first quarter or so just making sure that you transition well into the 4-year institution, okay? From there, you can start thinking about opportunities that you may want to engage in those 5 areas that we talked about. Within that, you want to think about finding mentors and building relationships. It's so important. There's research that shows that the students who use their resources, who get involved on campus, right, are going to be the most successful in college and beyond. And so we want you to build relationships. You'll always need a referral or a letter of recommendation for wherever you're applying. And so you want to network with professors. We have a program called Coffee and Dine with a Professor, for example, where you can have a sit down with a professor, or you can go to office hours. I was just advising a student on, they were asking, how do I get research in this field specifically? I say, go to our faculty website, see which faculty are in your area that you are very interested in doing research. See when their office hours are. Make sure you go in prepared, right? Do research on their research, okay? And impress them. Let them know, hey, I'm really interested in this area. If you have a spot open for a student, I would love to join the team if you could tell me how to apply. Okay, there's no cut and dry way to get certain experiences, but I like to emphasize the soft skills of networking and communication and learning to use your critical thinking skills to get those experience, right? So office hours are a great way to build relationships. Becoming a TA or an instructional assistant is super helpful as well. It just gets you really connected to the professor, and it gives you great leadership skills as well. Take multiple classes from the same professor. Smaller classes are sometimes not as feasible at a larger institution, but if you're taking multiple classes with the same professor, going to office hours, sitting in the front row, raising your hand, hopefully they know your face and your name. And then it's going to hopefully come to the point where you can let them know that you are interested in hopefully a letter of recommendation. And so, yeah, and then last but not least is join an affinity group. So a lot of students ask, what is an affinity group? So I advise students to join this type of group, which is basically a group where you have a shared identity. Okay, so maybe that's first gen, maybe that's transfer, maybe that's woman, maybe that's Black identifying, or whatever the case is, right? So find a group where you feel like you're plugged in. Okay, we don't want you to kind of float through college, go to class, and then go home. We want you to be successful. We want you to be plugged in. You're going to hear about a lot of opportunities that way too. The second group that we advise you to join is a career-related group. So that's something such as HMP3 or AMSA, or maybe I'm trying to remember, like the Pre-Dental Society, right? So there are many different career type of groups that you can join. And so join 2 of those. That is a priority, I would say, as well. So as we said, focus on your academics, start building a plan, get networked, join groups, okay, and take it step by step. Make sure your foundation is solid though as well. So give yourself a quarter or so to transition into the newness that is the 4-year institution. Ron, did you want to take this one?
Sure. So, we were talking about networking, and one of the things that we learned a lot from a lot of the healthcare professionals is, picture yourself already being there, right? So, as a healthcare professional, when you are networking, when you are reaching out, trying to get shadowing opportunities, when you're talking to faculty members about, what you're excited to learn from them about their research and their findings, think of it from the perspective of, I'm going to be a future professional. And as a future professional, I'm going to do the best I can to make sure that they know I'm interested. If I'm sending an email, I start off with being thoughtful about, okay, letting them know, okay, am I a part of their class? How does this person know me? Can I meet with them? If I meet with them, can I be mindful of doing the best to kind of present myself well for them, and having a clear game plan of, okay, what kind of mindset do I want to have in this conversation? This is somebody I respect, I value, that has a lot of insight. So it's important to have a mindset of, I'm going to learn from you, I respect and value you, and then hopefully that will carry over as part of your ability to network and be part of these different opportunities that we just talked about, right? And so part of what we do a lot do is encourage professionalism in reaching out, because it does impress them to see you really engage with them as a future professional, right? That goes a long way for a lot of these faculty and staff members. The other thing that we want you to think about is, uh, for different types of opportunities that you're going to be exposed to, you can decide, do you want to do them or not? And if you do, plan ahead, right? If I'm thinking of, maybe I want to look at different work opportunities that I can get away doing while working at UCSD, maybe I'm looking at some of those opportunities in November, so that by the time January hits, I'm already submitted at some applications to places I want to build experience or go to. Um, some of the things that we think about with these opportunities are, okay, can I position my previous education and work in a way that shows that I'm qualified to do some of these positions? If I'm applying to a research lab, did I do some of the science labs already that require those same skills, right? So these are some things that we try and instill is, you have the ability to engage with all of these different things. We just want you to think about, okay, what are my top priorities once I have been settled? right? And then start putting together a game plan of how I'm going to approach finding out about opportunities, maybe putting together a resume and cover letter, meeting with advisors, whether it's me and Jade or at the Career Center, and then focus on, okay, with the opportunities, what am I getting out of it, right? I think of it quality over quantity, depth versus breadth. I will say for med school applications, they expect a little bit of both, right? So breadth would be trying a few different things in either in your time here or from community college moving on to here. What were the different things that you've tried? And depth would be, is there any experiences that you have that you could show that you've had some commitment and some quality to develop? Right. And then some other things that sometimes students look into to further give themselves a combination of experiences, are there abroad programs? And abroad can be as simple as going and doing some clinical rotations for a free health clinic south of the border. Is there internships and organizations where I can be a part of, or maybe after spending a quarter or two at a student or being able to move into a more leadership capacity, right? A lot of my students think about, okay, what are all the different things I would love to do, and start coming up with a game plan on how I want to prioritize that while I'm here. And of course, as you're getting experience, I say this to everyone, please take notes. So log your experiences and make sure you're asking your questions as you are exploring and doing these things and capturing all of that, right? Eventually, you're going to need to talk about this, thoroughly in your application. What are all the different things that you've done, whether it's academic or non-academic, doesn't matter if it's healthcare or not. What are all the different things that you've done? What's important about those experiences? Make sure you're logging and journaling your work. And if you need help keeping track of that, we have an actual pre-health experience tracker on the prepare section of the HealthBeat website as well. And we can always talk you through how to come up a game plan with that during our appointments. And the best thing to do is just take notes in the best way that you can and reflect on what you are getting out of your experiences, because it'll make a huge difference by the time you apply. So real quickly, additional considerations for healthcare in general. You are going to need to do some test prep, and with a limited timeline, I get it. Sometimes the planning for test prep comes quick for my transfer students. So just to give you a couple of pointers, um, most of these tests expect you to get done with the majority of your prerequisites before you apply to the graduate programs that require a test. Once you know what profession you are targeting, make sure to double check the list of schools to see what kind of tests you might be taking. Pharmacy is the PCAT, medicine is MCAT. Some PA programs require GRE, some PT programs require GRE, some don't. Right. Dentistry has the DAT. So make sure that regardless of what profession that you are working on, just be mindful of working in some time to study for these standardized tests before you get to application cycle. But it usually happens towards, I would say, sometime between your first and second year here, or right at the tail end of your senior year if you are planning to apply past your senior year. Okay, so these are just some things that we would want to make sure that you're aware of. The other thing I will say very quickly is that UCSD also offers some additional resources sometimes. So you can also check out the extension website for some of their test prep options. So what can I do starting out? Create a plan for yourself, right? Include self-care, include acclimating to your new environment, include how much time do I need for sleep, how much time do I need to commute if I'm a commuter, what is my bandwidth, right? Make sure you're accounting for all of that as you start putting a plan together. And I know we've been harping on this, but network, join student organizations, get involved. It makes a huge difference in not only building a support and community, but also growing and learning and getting stronger, being in community with each other. You can follow us on Facebook or Instagram. We'll post a lot of helpful updates, upcoming events, job opportunities, experiential opportunities. And then it's never too early to start considering what opportunities can I do over the summer. You have a year to get used to everything. Just start thinking about, okay, this is what I can do during the year. Do I have some flexibility once I finish this year to maybe take on something that's a little bit more involved? It's hard to say until you start thinking about it. So I always just say, don't forget, around early winter is a good time to start thinking about that. And then last but not least, this is a whole learning process. So we want to make sure that you're reflecting and identifying not only your main motivations for doing the profession, but what you're getting out of your experiences. And of course, take this all with a grain of salt, of course, figure out your own pacing, but make sure you're still focusing on academics and then starting to incorporate all those other aspects as you work your way towards getting into a healthcare profession and applying, right? And again, recap. So academics first, then familiarize yourself with resources, figure out your timeline, and pace yourself, right? It is a marathon, not a race. And always, always, always think about, are there ways for you to engage, whether that's mentorship, building relationships, forming connections and bonds with different groups. So those are kind of our big takeaways that we want to go over. And then we're going to transition into Q&A, but real quick before we do, just some quick heads up. Career fair is coming up. So if you're looking for employment on campus, employment off campus, we're talking to graduate programs, including admissions at different healthcare schools. Please check out both our on-campus career fair as well as our graduate and professional school fair that is virtual. Those are great opportunities for a lot of our pre-health students to get additional access to different recruiters and people you want to know. Besides that, there are several opportunities coming up for you to get a lot of professional development. There is our Pumpkin Spice Your Career. It's a career development series done by career peer educators, and it goes over all the different professionalism basics you want to go through, from resume and cover letter to handshake, networking, job search, interviewing. And then again, Jade and I had mentioned our Med Prep course, Med Prep 101. It's open to transfer students, so keep an eye out for it on winter and spring quarter. Open houses tomorrow, so if you have a chance to stop by 10 to 2 at the Career Center, you can say hi to us. We'll be there. And then we do pre-health drop-in week. So drop-in week is usually around week 4, I would say, every quarter. And it's really a place for, okay, I'm dropping a class or I'm changing what I'm planning to do and I just want to check in with somebody, right? So it's a good time of the quarter when a lot of people like to just do a quick drop-in and give us a heads up and some, ask us a couple questions. And so we make that available during week 4. And then, of course, last but not least, join Tritons Connect. Very easy, tritonsconnect.com. If you're looking for mentors and people who are alumni that have been in other professions or healthcare professions, it's a great place to start. Okay, so those are just some basic resources that we wanted to remind everybody about. This presentation is going to be recorded, as well as we are going to provide a slide deck to those who participate. Okay.
Awesome.
All right.
So let's jump into some of the questions. I was answering some kind of on the side, but let's go into our first question. Are there any shadowing opportunities for international students? If so, where can I find them? Ron, did you want to answer this one?
Yeah. So, I mean, we list a few. Shadowing, for better or worse, is highly driven by networking and what kind of shadowing you are doing. I will say dentistry tends to be a little bit easier for shadowing because there's a lot of private offices that you could reach out to see if there's that opportunity. For healthcare facilities, it gets a little bit more complicated just because if you're shadowing and it's a hospital, you are the biggest liability. Right. So we usually see shadowing more likely in kind of less busy subspecialties, low risk subspecialties. And that's more of, cold messaging, finding out information from different instructors. I will say a lot of my international students look more at, okay, are there internships that I can get credit for? Is there volunteer work that I can do that have aspects of healthcare in it? There's also student-run free health clinic, which everybody can apply to, which actually does some clinical work as facilitated volunteers. So it's not quite the same as shadowing, but I always like to put that out there. Shadowing, it doesn't matter if you're international or not, it's just tricky because you have to network. And that just requires putting yourself out there a lot.
Awesome. Okay, and then the next question are, how often do you see students combine 16 units, part-time job, research, volunteer, et cetera? Essentially, the pre-med student that does it all, or do people at UCSD often save a majority of their extracurriculars for summer? What is the split? So I'll answer this. I think it's going to depend on the student. It is a lot, I will say, for pre-health, pre-med. So you have to decide what works for you and what is your capacity. Would you want to stay an extra couple quarters and get more extracurriculars done then? Or would you think that you can take maybe 12 units and do maybe a volunteer opportunity or research opportunity? I would say most students are doing kind of their basic units, 12 to 16 units, and are doing maybe a couple of opportunities, and it's going to depend on which year they're in. So if you're first year transfer, give yourself a quarter to kind of adjust and also think about what you want to do the following quarter. And then I would start getting some, maybe one opportunity under your belt while you're taking coursework, and then kind of build from there. If you find that you're taking 12 units and doing one opportunity and that's good enough, maybe add another opportunity or add more coursework to your plate. So you'll have to decide. And then so Ron and I can also work with you just to kind of see where you're at and maybe what your timeline is looking like as well. Okay. Does taking a gap year have an impact on your medical school application? When should we prepare and take the MCAT? So I put the 4-year timeline on one of the questions in the chat. We have our timelines posted on our HealthBeat website, so just feel free to go there, click on prepare and apply, and then you'll see our 4-year timelines listed for the relevant program that you are pursuing, okay? So the gap year is listed on there. Most people, what they do is they take additional coursework, or they get more clinical experience, or they get certified in something, but they're being productive, okay? So no matter what you do, be productive, because you will need to talk about this in your interviews, if you get interviews, about what you've been doing during your gap year. In some of the secondaries, so basically the application questions, they'll ask you, what are you planning to do during your gap year, okay? And that's totally fine if you take a gap year. In fact, 70% of students almost are taking a gap year. So chances are you probably are gonna take a gap year, even if you're not planning to, just because it is a lot. It's a lot of work to, as the previous student said, do the extracurriculars and get your grades, make sure your grades are up and all this stuff. So it is usually needed to take a gap year, and that's totally fine. As far as when you should prepare to take the MCAT, look at the 4-year timeline. You generally want to take it no later than January or March, the year that you're applying. So applications open in June of each year. So the next one will be June of 2025. That means you should take your MCAT no later than, I would say, March of 2025. You can take it as early as January or even of 2025, or even October of 2024, so the end of this year. It just depends on when you're applying to the program and when you're ready to take the MCAT. Again, look at the 4-year timeline, and Ron and I can talk to you a little bit more about this too. And I know we're at time. I did say Ron and I can stay a few minutes over to answer your questions. We did go a little bit over, but we want to get to all of them. How can I get a personal career advisor that can help me with any questions about the PA program? So go to Handshake, and there are no personal career advisors, but we do have career peer advisor drop-in hours. I don't know, Ron, if you want to put the hours in the chat, but those are during the week, in person, and I think virtual. It just depends on which one you go to. The other way is you can go to Handshake, click on Career Center, click on Appointments, and then you can make a one-on-one with Ron or myself. Please note that we do have a ton of requests. It's pretty impacted the first month or two of fall, so you may see limited appointments until around November. So I just want you to be aware of that. You might find appointments before that, but I don't want you to freak out if you don't see many appointments before that, okay? This is why we're doing the orientations, to make sure that we help you get a good launch. So yeah, and then how can I get shadowing hours? How do I reach out to local dentists to ask for shadowing hours? I'll answer this one, and Ron, I don't know if you want to answer the next one.
Okay.
So for shadowing hours, this is a soft skill, okay? There are no specific programs, except for maybe one for pre-health, pre-med. Most of your shadowing for any healthcare career that you want to go into will come through networking. That means, right, I throw around this word networking, that just means building relationships with people. So I usually advise students to go on LinkedIn. If you don't have a LinkedIn, you definitely need to make one. Okay, so there is a UCSD alumni tab on their page on LinkedIn, and you can search different alumni in your field and you can reach out to them. We also have Tritons Connect, which was on the screen a few moments ago, tritonsconnect.com. If you have a LinkedIn already, you can actually link your LinkedIn to Tritons Connect and it'll autofill your information and you can find mentors on there. Some people even cold call or cold email offices, but I think the most efficient way is to reach out on LinkedIn. After that, it will be, sure, you can find any clinics in your area. I would say that are smaller clinics, not larger hospitals, because there's going to be a lot of red tape, so to speak, in larger hospitals if you're trying to shadow, versus if someone owns their own clinic, they may have a little bit more jurisdiction to say, yeah, you can shadow me and it's not an issue. So yes, there are no set pathways to shadowing. We do have in our experiential opportunities, though, the Pathmaker internship, which I don't know if that includes dentistry, but for all my students, you can look into that. It's called the Pathmaker internship, and you can get hands-on clinical experience more formally if you want it. Okay. Did you want to answer the question?
Yeah, so there's a couple things that were on chat that I'll just kind of hop on for. Where's the free clinic? It is in South Bay, so it's a bit of a commute if you are going to either drive or take the blue line all the way down. That's UCSD student run free health clinic. We have a link to that. I just put in chat our general prepare section that has the experiential guide on that page. So if you just click on the experiential guide, like Jade mentioned, they'll have Pathmaker internship and a lot of the different opportunities that we at least have been aware of that students either have tried out or that have been recommended to us by faculty, staff, and other healthcare professionals. When you said I saw another interesting question there about my goals to be a PA. Do I have to declare pre-med? No. It's more of, are you pre-health? Yes, you're probably working with one of us at some point in your career. There's no declared pre-health specific title besides, students, when you first matriculate, you usually click on a button like, I'm interested in healthcare. And that's how we know that there are a good amount of students interested. But outside of that, it's really just planning accordingly, scheduling time to meet with us if that's the profession you're going to go work towards. Pro tip, I also would check out the UCSD PA program. They have scheduled webinars and in-person meet and greets with the program. So if you want to get some face time with an actual PA program, great opportunity to do it right here. Okay. And then I don't have any phlebotomy resources. It's kind of a tricky one. Usually a lot of the community colleges will do some of the certs like phlebotomy. So that would probably be the first place I would go, for that. Let's see here. And then the other question I had is, I want to shadow a medical examiner or forensic pathologist. Do we have any advice on contacting a coroner or hospital? That's tricky. So I would say if you are going that route, we might want to talk about a communication strategy and networking to do that. But we wouldn't have necessarily any specific recommendations for that. That is a very specific ask, and that might just be putting yourself out there to try and get access. Let's see here. Does major difficulty account for how your GPA is viewed when applying to medical school? Not quite. They can understand what your major is, but remember, no matter what your major is, there are going to be science classes you have to take, right? So if you don't have as many science classes outside of your major, understand, or if you don't have many science classes because of your major, all the classes that you do take are going to be viewed or utilized more heavily, right, in the evaluation process. BCPM is its own measurement. So It's not that they will treat you differently, it just means that they have a much more limited data set of courses that they have to look at to understand your proficiency level. Okay. Any and Jay, did you want to mention the
Yeah.
survey real quick?
Yes, so before we continue answering questions, please fill out our post-event survey. I just wanted to share my screen so you guys have the QR code, but we'll still continue to answer questions. I can jump on the next one if you want, Ron.
Go for it.
Does your major difficulty account for how your GPA is viewed when applying to medical school? So the prerequisites in and of themselves are difficult, all right? So do well in the prerequisites. That is what's going to be most important. Now, if you're, say, like an engineering major, bioengineering, or maybe something that has more rigorous courses, more coursework, more units, right, that will account in your application. However, what the admissions are reviewing is something called holistic review. Okay, so holistic review means looking at the person as a whole. They are actually going to be looking at not only your GPA and your MCAT score, but your extracurriculars. They're going to be looking at any competencies that are relevant to the field that you're going into. Did you meet those? How are your letters of recommendation? Did you really portray your why or your vision of going into your chosen program or graduate school, right? So they're going to be looking at you holistically. They're really going to be seeing, is this person a well-rounded and developed enough individual to make it through medical school or dentistry, right? They're going to also look at distance traveled, meaning how much did you overcome? Were you resilient in overcoming these things? What life lessons did you learn? So I would say major difficulty will be a very small percentage, and I would not focus on that. I would focus on the other aspects of holistic review in order to be a competitive applicant. For example, I've seen people with difficult major and a very high GPA, like a 3.8 or 3.9. And someone with a 3.6 or 3.7 got in over them because they had a better overall application with a better personal statement. They demonstrated multicultural competency. They demonstrated ethical responsibility. They demonstrated service orientation, and they were very well at. They did a very good job at portraying that to the committee in their letters, and also in their experiences section. Okay, so I hope that gives you a well-rounded answer of that. Let's see. Do you want to answer the next one, Ron?
Yeah.
Overseas medical internships?
There's like it's not as often. I'm going to say that. A lot of times, if it's overseas, it's usually a student who was going to be there anyways, happening to find an opportunity. Um, I have seen sometimes they'll have like shadow abroad opportunities by organizations like Atlantis Medical. Um, so I mean, there are some opportunities like that. We don't see it as often. The main reason I'm going to say it is because usually when we're talking US healthcare and medical schools, for example, the primary expectation is that the healthcare experience that you are going to get is from a US healthcare context so that you're better informed of where where you're going to potentially work in the future. Right, is with a U.S. medical healthcare context. That is the expectation. So it can be helpful for context and difference, but we don't really have that many resources or information on it just because it's not as much of a widely used or area, because not many students necessarily would have the ability to do that and also juggle all the other areas that they're trying to do, like getting in U.S. healthcare system experience. Um, and then how can
Okay.
I get into research as a first year student? Real Portal, visit the undergraduate research hub. They have a lot of great programs specifically for students regardless of your year. Okay, they have everything from first year to senior there, and they do events, especially in the fall, for you to network, so that you can get some face time with researchers and research opportunities. And then I would also check Handshake regularly alongside the Real Portal. Those are all really good starts. If you are a transfer student and you go to the transfer hub, they also have a specialist that can help you figure out what research opportunities might be good for you as a transfer hub peer educator. They have one that can support you as well. Okay. How many hours of clinical experience are considered impressive for medical school? I would say our starting threshold is around 200 to 300 to feel comfortable that you should theoretically have enough experience to talk about something. Anything past that or above and beyond that really is more a matter of how well can you articulate what you've learned, distance traveled, the things along the way that better inform who you are as a potential physician, but it's not necessarily a set number. We just kind of have a minimum threshold just because we're hoping that you guys get enough hours that you can really talk about it. Okay. Um, yeah. So there's no easy way to say impressive because I mean, sometimes they'll say like, okay, you did all this experience, but if you don't have anything to say about it, it's a lot harder to justify the experience.
And
So
then,
yeah.
oh, sorry, go ahead.
Oh, I see. That's it. It looks like we're good.
There was one other question that
Okay.
I said that I answered, but I haven't answered yet. So, what was the PA thing that you mentioned? So that's called Meet the Program. That is, I will send you the link on the answer. So basically, what you can do is go to the PA programs page, and they have many different events that you can attend just to learn more about the program. I would recommend that for any healthcare career. Check the programs that you want to go to and see about their information sessions. It's a great way to network. It's a great way to learn more about the schools, the mission. It can give you a little bit more insight into how you can tailor your application for that school specifically. So I put that, the PA school's website in the chat in the answer. All right, we can do all of them.
Yep. All right. I'll stop recording.